Hi everyone, I am Dr. Apurva Gupta, gynecologist and obstetrician practicing in South Delhi, primarily consulting at my clinic, Gynaecologist Women's Clinic, which is based in east of Kailash. So today I'll be talking about probably the most asked question by all pregnant women. I think all pregnant women ask this question. Doctor, how would I know my labor pains have started? How to distinguish labor pains from other pains and aches that one experiences all through pregnancy? And it's just by popular demand that today I'm doing this short video on that. So, friends, the first thing one should remember about labor pains is that labor pains are never continuous. They are always intermittent, as in they come and they go, they come and they go. So there will be a span in which you perceive the pain, and then there will be a pain-free interval. Then again there will be a span when you perceive the pain, and again there will be a pain-free interval. So this is physiology of labor pain, and this physiology remains even till the end point, till you deliver. So, supposing you've had a pain, like you call me up and say, I've had a vague pain which is persistent since morning. It can't be labor pain because labor pain would come and go, come and go. Also, the intensity of pain would gradually keep increasing. As in, first you were perceiving, say, this much pain, then you start to perceive this much pain, then you start to perceive this much pain, and the pain-free interval keeps decreasing. So suppose you were getting, say, pain of, say, X after every 5 minutes. Now you're getting maybe 1.5X after every 4 minutes. Then you get 2X after every 3 minutes. So that's what I mean by the intensity of the pain keeps increasing, the pain-free interval keeps decreasing, and the duration for which you perceive the pain, like earlier you were perceiving for 5 seconds, now you perceive for 10 seconds. So the duration of pain also keeps increasing. This is the primary characteristic of labor pain. For most women, labor pain would start from the back and move towards the front of the abdomen. So many women would complain of I feel like there's an atom bomb in my back. So most of my patients have said this. That's how I'm bringing this colloquial here. So the pain normally starts from the back and then move towards the abdomen. For some women, of course, one may perceive it directly in the front of the abdomen. Now, labor pain may or may not be accompanied with discharge of various types. For some women, there is, you can see sometimes the dispelling of the mucus plug. So once you go to the washroom, you may see that there is a mucus plug, which may be blood stained with mostly brownish blood. So that mucus plug normally plugs the cervix or the mouth of the uterus. And when the labor is about to start, that plug gets shed. So we call it the show. So nature is showing us that the labor is about to start. Presence of show may or may not be accompanied by labor pain, and start of labor pain may or may not be accompanied by show. Some women may have a bursting of waters before labor pains or after labor pains. Now, what is bursting of waters? Normally, you would experience clear urine-like liquid or nariyal pani-like liquid coming out of your vagina. So, many women initially mistake it for wanting to go for urination again and again. And it's only after 2-3 times they figure out that it's not really urine. Even if you've had discharge or burst of your water, you must report to the hospital even if you don't have labor pain. And if you have pains, then you must report to your doctor and reach the hospital with or without discharge. At any point in time, if you feel your waters have burst and they are accompanied or it's blood-stained water, as in frank blood-stained water or green-colored water, then you must immediately report to the hospital. So these are primarily the characteristics which would help you distinguish labor pain from the routine aches and pains of pregnancy, so that you would know that, okay, now this is authentic labor pain which has started and this is a green signal. Now I must call up my doctor and report to the hospital. So hope this helps. Thank you so much for watching this video. Bye-bye.